Thanks so much for turning up today. It's been a very interesting discussion throughout today. We've heard about mental health solutions and initiatives in Bristol, ways of making the service much more focused towards patients in their own homes and giving them the help that they need to live, support in housing, all sorts of things like that. We've been asking about the caring society. Is it caring enough? And now we're going to be moving the discussion on to really the future of health funding, given the burden that we're placing the health service under with our success in living a long life. When I started my job 20 years ago as a health correspondent in the BBC, life expectancy was far less, but with developments in medicine, people are able to live longer, and not necessarily as good a quality life as they would like, but it means that people in charge of our hospitals end up having to face huge rises in demand, as well as they may have had year-on-year funding increases in the health service, which have obviously tailed off in recent years, but the actual cost to the health service, the inflation within the health sector, far exceeds any rises we're likely to see in the foreseeable future. So that's why we're going to talk about what changes could be ahead. I mean, in my job, it's always been interesting to see how many changes we've had since we had sort of health authorities many years ago changing to primary care trusts that were considered too small, and then they merged into bigger primary care trusts, and more recently with the health reforms, we've got doctors in charge with clinical commissioning groups. And the prospect of even further change is somewhat daunting. But nevertheless, I'd like to introduce our panel. We are minus Jonathan Hales at the moment, who has had a car crash. He's fine. In fact, he's determined to join us in about half an hour, I'm told. So standing in for him, we've got Dr. Peter Wild, who's the organiser of today's event. He's a cardiologist, recently retired from the University Hospitals Bristol, with a distinguished career, taking on Tony Blair many years ago in a Newsnight discussion that I helped set up over funding, and actually I'm sure being instrumental in increasing the Labour, the amount of money that Labour Party were putting in at that time to the health service. So a very important man, really. So he's going to start off giving us a slight overview. Also, I'd like to introduce to you our other panellist, Karen Smith. She is the prospective Labour Party candidate for the Bristol South constituency. She has experience in working for the CCG, so we'll be getting her views as well as Jonathan Blore, who's founded .com, which is you'll explain more about that later, a website designed to bring about better patient care through better use of technology. And Sir Ron Kerr, Chief Executive of Guy's and St Thomas's, who was the Chief Executive locally at the University Hospitals Bristol. You took it through Foundation Status Trust and all the rest of it very successfully. And he's going to talk about the political climate at the moment and how he sees things panning out. But first of all, Dr. Peter Wild will give us a slight overview.